Joanne.
Good morning, Candida.
How are you? I'm going to put my glasses on so I can see you.
There's a good idea.
And then I will take them off in a little bit because they glare. Hey, how are you? It's Mental Health Goes to School. And I am Dr. Candida Fink, child and adolescent psychiatrist.
And I'm Joanne Berry, special educator. And we're here today to talk about the intersection of mental health and education for adolescents. So I read this article called Accommodation Nation in the Atlantic, January 26th. The author is Rose Horowitz.
Yep.
And it discusses the growth of use of accommodations at the college level. This includes things like extra time on exams and projects, separate setting for taking exams, like not being in a room with a couple hundred other people, and having some sort of smaller or completely separate setting. There were some other ones, but those are the most used. So that made us think that this is something that our listeners, viewers would be interested in, as many students are looking ahead to applying and attending college.
And I think it's a the article is the headline is provocative, right? And that's sort of like, oh, are too many people getting accommodations and in college for non-physical disabilities, basically, is what they were saying. The expansion, the growth of diagnoses like ADHD and depression, anxiety, and that there are, many more people for a lot of reasons, right? The expansion of diagnostic criteria, expansion of definition of disability a bit, so that has opened up these options. And so, the numbers, the rapid growth of numbers of people seeking accommodations for these kinds of things. And what does that mean? Does that mean we're overusing, right? Are people abusing the system?
I think for our purposes, the bigger question is not as important as the more direct, should you or can you get accommodation? So first thing I would say is, if you have been using, or your student, your child has been using accommodations such as extra time or a separate setting, and that has helped them be successful at the high school level, you should very likely continue to use that to continue to be successful at the college level. It's kind of like, oh, I feel so much better that I've been taking my medication. I could stop now. No, don't keep it. It's been don't consider it a crutch. Don't consider it something you don't deserve. Just consider, what do you need to be successful at the college level? And if it turns out you don't need it, not a big deal.
Right. And I think that's what I think very much so is our point, is at least from our population, from people we work with, my patients, your students who have, been struggling and identified needs. The challenge is more about not seeking the accommodations than overusing of accommodations, right? Either not knowing how to look for them, or we've run into this, I run into this a lot, that families will, especially with their first child going to college, may not realize that accommodations don't automatically follow a child to college. There are separate disability systems for K to 12. And then once you're in college, it's a different set of regulations and accommodations. Law is different. So, and every college requires you have to do a new application for accommodations or supports to be included or registered with the disabilities office. So that's a really important thing. As you said, number one, don't just drop the accommodations if they've been helping you. Number two, you do have to apply. They're not going to just follow you.
Right. So identify what the office is. Once you've been accepted and chosen which school to attend, identify the disability support office, academic support, whatever it's called. And you may be required to bring documentation of your most recent psychological testing. which should have been within the last 3 years,
3 years.
which, if a kid was in 10th grade and now they're going to college, that might have changed. But keep that in mind. You might have to have that in the most recent IEP.
Right.
Now, they are not going to just transfer all of those IEP accommodations if there are several, but it will inform what they are able to offer and what they do offer. I was just thinking something like differentiated instruction, probably not going to be. You might have access to instructor notes or note-taking service.
Right.
Is another one.
Or the ability to record the lecture.
Right.
Audio or video.
That sort of thing. Plus the extended time in separate setting. Those are the most typical, I think, most common. Yeah. But different, like fewer requirements. No, it's like, do you want a college degree? Then you've got to meet the requirements. We can't decrease the requirements
the number
for the degree
required. They may, I do have on occasion had families seek the ability to maintain a full-time status at, say, 12 credits instead of 16, because reducing credit hours I have found with families can be one of the most powerful supports. And a lot of times you can stay, it automatically keeps you full-time, even if you take one less class. But sometimes that does require some negotiation and, accommodation type of work through the Disability Services Office. I emphasize that a lot with families. Like if you're planning your schedule, if you've had a lot of struggles, there is absolutely minimal downside to saying, let me start with 3 classes instead of 4 or 4 instead of 5, depending on the credit structure in your college. It can make such a huge difference, especially right at the beginning, and you're getting used to college level work and that kind of thing. So that's an accommodation. It's not always an accommodation, but some version of reduced course load to improve, accessibility and likelihood of success is pretty big deal. And I will just say too, even before you're accepted, when you're looking at colleges, to try to get information about college supports and the office and how people find, how much support you find is available, how they identify themselves, each individual college, what supports are available, how accessible are they, how accessible are the accessibility.
Right.
This kind of thing. But exactly. So as you're looking, and once information, connect with the office, and you can think about different kinds of accommodations. Extended time being, as you said, like the biggest, and a separate section, separate low distraction environment being the
right. And I will just point out, open to any student, regardless, is tutoring.
Yes.
And some kind of writing center specific to writing.
Every
and tutoring in any class that you might take. There's generally a tutoring center. You can go and get matched up with somebody who took this class last year or the year before and did well in it.
Right.
And can help you with that. And that's open to anybody.
Volunteer sort of tutoring upperclassmen or taking the class.
And that's open to anybody regardless. So consider that as well.
And the other office hours. That's the other thing I say, right? Off the bat to my families and kids is go to office hours. Even if you don't think you have a specific question, go to an office hour, introduce yourself to the professor or the TA if it's a massive class and you're just in a section, but go in, introduce yourself, listen to other people's questions. It's a fabulous and completely free, everyone available way to engage with the material, engage with your teachers, and to get your brain working and to get the kind of support. And they can often find you an upperclassman or someone who's already taken the class who may be able to help you if you're struggling. Yep. It personalizes it and brings it down. So that's another, I love the idea of these resources available to every kid, regardless.
Right. And so the next thing, once you have gone to the disability support office, and they said, okay, you are eligible for these accommodations. Now it is up to the student to be proactive
Yes.
and go to the professor,
Right.
probably at very early in the term, as soon as they tell you when the office hours are, try to get there and say, I
Right.
would like to have this accommodation.
Right.
And you might have to remind them, remember,
Right.
this is not their primary job.
Right.
To remember that's your job. You have to remember to ask for it. You might have to ask if you need extra time on exams. You might need to ask every time there is an exam.
To set up time in the testing center, that kind of thing.
Right. And to have, or if you need a low distraction setting. One of the things mentioned in this article is some places kind of run out of space.
Right.
So this is a relatively pretty well used accommodation. So be prepared to be maybe if you were thinking you were going to get your own small room, you might be in a room with half a dozen people. I don't know what the settings would be, but it would be different than being in a room with a large lecture, hopefully. So keep that in mind. You must be proactive about requesting the accommodations. And if you haven't had them as you've gone along in high school, just because your school doesn't have the resources, you and your parents didn't quite figure this out, still,
it's okay.
Check it out. Check it out.
Check out, but we were emphasizing the fact that kids who have had diagnoses all along or for many years, right, and you've had services, absolutely 100% seek out services, supports the disability service office at your college. Even if you haven't, because, part of what this article addresses is the sort of unjust distribution of accommodations, in that people with more money, more resources, more hooked in, more of those people are getting accommodations. And, that's another argument about whether every single one of those kids needs the accommodations. But what does happen is that kids with fewer resources, bigger high schools, fewer resources at the high school or even earlier, may get missed. And so they may not end up having had substantial supports or accommodations before college. But if it turns out that you think that there is something going on and you would like to pursue an evaluation, you can, speak to your high school before you graduate, speak to your special education services, your school psychologist, your school social worker. You can get more information. We talked about, just to get more information about it at the public library, there may be resources to learn about the types of things that can be used to, the types of things that can interfere with learning that are related to mental health, neurodevelopmental disorders like ADHD, anxiety, depression. These are common. These are not uncommon disorders. After we read this article, I just went to quickly grab, some ideas, and something like, I don't know, where was it? It's a lot of kids. 16% of kids, when these are big, survey studies, have symptoms of ADHD, whether they're diagnosed or not. That's a lot of kids. Yeah. And depression, 10% or so, if you go and look at these big studies. And anxiety was something like 25 to 30%. Right. So these are not uncommon disorders that are going to impact your academic function. So do not be dissuaded when it feels like, oh, people shouldn't get accommodations for these things, or you're embarrassed or feel like you don't deserve them, or families are hesitant. These are services that are there. There's a reason that we put these into place by law in this country. It's to give you access. More and more young people with those kinds of disabilities are going to college now, or thinking about college, right? We were talking before we started recording that, like, in our era, people just didn't go to college. If that stuff had become really, had such a negative impact on academics, they just wouldn't go, right?
Or would go and bomb out. Because, it's like they couldn't work fast enough, or couldn't take a full course load.
Exactly.
Right. Those sorts of things. Or,
evolve into a mental health crisis. The presence of supports, the the higher rates of identification of these disorders, all of those kinds of things are leading to this increased rate of seeking accommodations. And I will say what I say the same when people say, oh, ADHD is overdiagnosed, and I'll say it's still underdiagnosed and overdiagnosed, right? There are people who get too fast a diagnosis, too quick, and I think there are probably people who are misusing the system and getting identified when they really don't need these services. But I think the bigger issue is still so many kids who don't, right? And especially at the level of resources, the accessibility for people with fewer resources. So the concept of accommodations for quote unquote invisible disabilities like ADHD, depression, anxiety, those are absolutely well established reasons to get accommodations, right? To get connected with those and at the college level. So don't think what you and I are saying. Don't be dissuaded. If these are things that either you've already gotten supports for, or there are considerations that these have played a role in some of your struggles and you would like to look into it at the college level, and you feel like it could help you navigate college, these are very real. These are not made up things, and they're very common, right? So
right.
I think that's, I think both of us really want people
right.
to know that.
There certainly are larger questions about what is the appropriate role for this sort of thing at the college level, but that's beyond what we could tackle in this conversation. And our role is to support students and families to get their best, to be their best. And if you want to attend college and feel like it might be too much, and keep in mind too, life is not a straight path. If you need to take one or two classes at community college and try it out as a ramp, if you're thinking of a 4-year school, or ability to take part-time at the college of your choice, or to just take some time and not think about school for a little while and figure out what might work best for you. Those are all certainly options. And
so many kids worry about falling behind, like, oh gosh, I'm not going to graduate.
Yeah, what does that mean?
And that is a very common conversation. I know you have it with your students. I have it with my kids, my patients and families all the time. It's not a straight line. It's not linear. And especially once you're out of high school, people go on just so many different trajectories in terms of education, career, jobs, and mental health issues will impact that. And it is acknowledging those and identifying them, getting the support and help you need, and allowing yourself to work with that reality is so powerful. And take the time to, these sort of, I have to be with my peers. I can't, what if I graduate a semester late? It's a year late, 5 years late, 7 years later. It's okay. That is not lost time. That is time you are doing things for you, and you're still learning and growing no matter what it is you're doing. So, or what it is you've engaged at or that you're attempting to do, it's okay. Right. That sort of frantic race to, well, what if I don't? What if I, meet yourself where you are, get the supports and resources and help that you need, and take it one step. It's so much easier said than done. I will also say community colleges have disability services office. Every college does. So get help. They have, and many of them have tremendous tutoring resources, student support resources available to every kid. Every student, they're not all kids, of course, at community college, but available to every student, just we talked about, and community colleges are no different. And they also have offices for accommodations and that kind of thing. So, I mean, a community college is a powerful, powerful tool. The 2-year college, community college access point for many people is just don't minimize it, don't take it off the table, and use the resources there too, if that's what you, but I think that was one interesting part about the article, is it, two-year colleges and public colleges have lower rates. I think it's often because of a lack of information or perhaps coming up through a school that didn't have the resources to sort of know about these things or to get identified. So the issue is more expanding access across ranges of socioeconomic groups, types of colleges, types of even other educational programming, trades or vocational programming. We want everyone to have those resources available to them to get the support they need to succeed, regardless of a neurodevelopmental or psychiatric disability in any setting. Right.
Right. Yeah. 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 It's like pursue your interest, be your best self.
Right.
And if you don't go to college between the years of 18 and 22, that's
right.
I don't know. There's lots of reasons why it got.
Yes.
That's what people think of. But there's certainly other paths, other ways to get to where you want to be.
Yeah. And you're not alone. You are not alone. That's why we do this, why we have these conversations, how we started this podcast, is because so many families and students feel like they're the only ones. And we can tell you, and our listeners can tell you, and anyone who's in this space can tell you, these are incredibly common, and struggles with these stories and these kinds of challenges are just, they're widespread. You are not alone. Ask for help, seek services. Agencies like NAMI is another place that can be a big support. They have a lot of resources online and guidance for where to look for help or how to connect with things. So understood.org is another one. Has a lot of information about, I think, more K-12, but at least sort of the idea of accommodations and supports, I think specifically for learning disabilities and ADHD. So we'll put those in the show notes, some of our resources that we talked about or came up with. But so our takeaways are what, Joanne?
If you think any of these kind of supports will be helpful, be sure to engage with the Disability Support Office or whatever it's called,
right,
as well as the individual professors and instructors.
Yes.
For each class.
Yep.
And it's okay too if you think, oh, anytime I need to write an essay, I need help. Anytime I'm doing math, I'm good. That's fine. You don't need to use it across the board. Use it for what you need. And also take advantage of the supports available to everyone, through tutoring, writing center, class notes, which might be posted, all of those sorts of things. Use all the resources that are available to you because it's your life, it's your education. You deserve to be able to access it the best way you can.
Yeah, exactly. And being proactive and feeling comfortable seeking help. That's what we want to encourage you to do, that it's okay. It's not just okay. It's really going to be a powerful tool for you and your family.
Right.
Talk to your medical team. If you have a mental health treatment team, from my end, be sure to talk to them about how they can help you get the supports you need. If you have questions, even if you don't have a mental health team, talk to your pediatrician's office, to your pediatrician about, they have information as well, or family doctor. So, everybody's access points are different, but these are medical conditions. And so working through your medical team can also be a way to access information and guidance. So just something else to know.
Right.
And use that public library. They have so much information. Librarians are great resources to help you navigate questions you might have about how does this work, So
right. Yeah.
Yeah. So those are some thoughts. You have a good thing this week, Joe?
I was trying to think of what. And mostly, well, here's a kind of a comical thing. So I have this cat, 14 years old.
Oh.
She stole some roasted cauliflower and ate it.
Like,
oh, okay. And then, so yesterday I gave her a little piece of broccoli. Nope.
No.
Broccoli and cauliflower are not the same.
The same. Thank you. Thank you very, very much.
So I just thought that was funny.
Yeah. Yeah. Well, I've been cold, just so cold. Even the days that were warmer, it's just damp. It's winter, it's not like 50 degrees in January is not the same as 50 degrees in May or something.
Right. Yeah.
So I have this heated throw on my couch, and it's just like, I just sit that, like, if I'm drinking my coffee, I just feel like I'm constantly staying warm. So a good thing is I ordered this thing. It was cheap and it's delightful. And B, the cat, I walked away and the cat had managed to wrap themselves up into
Of course.
a cat burrito, or a burrito, as Julia called. So maybe we'll post that. I'll post a picture of the cat.
That's funny. Yeah.
In our show notes, just for fun.
Yeah.
Because we need to take some delight in all the things around us, because that's what we do. That's every day, right? Look for something good. Okay, so here we are. What do we say?
So hopefully you can like, follow, review.
Yep. Yeah. If you can review us, and we need a few words, 5 words.
Yep. That helps.
If you have beef with something we said, or you have other thoughts about this article, and you want to have a conversation, please let us know. Interaction is great. That helps our podcast grow and expand the conversation. So like and follow and comment or review. This is good stuff. And every conversation we have out and about with people, we find interest. So help us kind of expand the conversation. That's what we want. Right. So we will finish here and see you on the other side at the next episode. So, and if you're watching it, but if you're looking for the video, if you're just listening, we're on YouTube. Our website is mentalhealthgoes-to-school.com. Our YouTube is Mental Health Goes to School. We're on Instagram as well. I think there's a Facebook page, maybe LinkedIn. We've got a few other places where people are catching us. So, find us and spread the word. All right, Joe. Talk to you soon.
See you later.